Good afternoon. I'm Damien Angus, a partner in the healthcare strategy team at PwC. PwC are proud to be sponsoring this event together with CEDA. Today, the live stream event is mental health in the time of COVID-19, and we've got over 1,800 registrations. So thanks for joining. I would like to begin by acknowledging the traditional owners of the land upon which we virtually meet. I'm speaking to you from Melbourne, on the lands of the Wurundjeri people of the Kulin Nation. I pay my respects to the elders past, present and emerging. And I think it's appropriate, given the topic of health and wellbeing, considering that Aboriginal and Torres Strait Islanders have a particularly poor outcome in both their physical and mental health compared to the rest of Australians. At PwC, our purpose is to build trust in society and solve important problems. And I think that improving, strengthening and supporting people with mental health issues at this time is a critical challenge for us all to solve. It's my role today to briefly set the context for this discussion, and then Melinda, the CEO of CEDA, will introduce our guest speaker, the Honourable Gillard, former Prime Minister, Chair of Beyond Blue, who almost needs no introduction. So to set the scene, I'd like to talk briefly about three aspects. What's the recent impact been of staying at home? What are the impacts of the economic challenges that we have to come? And what are the priorities, opportunities and practical things that we can do now to improve the mental health of Australians? Turning to the impact of staying at home. You know, for some, staying at home has almost enabled them to live their best lives. No commuting, daily exercise, home cooking, family time, a sense of community. And we've also seen inspiring acts of kindness, of compassion, of humility and care. Not to mention Australian ingenuity, creativity, and the massive push around research and development to develop a vaccine or to care for people or innovate in the model of care. It's been a source of both hope and optimism for the country and from around the world. But for many, it's important to acknowledge that home is not comfortable, home is not social, and home is not that safe. And loneliness, anxiety, fear, depression can all manifest. And then what about the economic impacts? We know that financial well-being and mental health can be strongly linked. And we know that over this period, there's going to be a lot of Australians that are going to be doing it tough as we slowly rebuild our economy and return in some form to an Australian way of life that we know and love, but will be different. This really sets the challenge for us of how do we take care and look after those that are more vulnerable and are suffering from mental health challenges. So what are the priorities and opportunities as we look forward? As we look forward to returning to schools, opening up, reopening up workplaces, and how do we really think about what is the support for those that need care with their mental health? How do we provide the right support at the right place at the right time? And I think from our perspective, one good lever here is telehealth. We've seen a massive shift in terms of the telehealth adoption over the last few months. And I think that digital solutions and telehealth have a great opportunity to support people with their mental health, to help strengthen it and to get the care to where people need it at the right time. So let me now hand over to Melinda, the CEO of CEDA, and I look forward to the presentation and to the discussion that follows. Thanks very much.
Well, thanks, Damien, for that fantastic introduction. As Damien said, I'm Melinda Cilento. I'm the CEO of CEDA. It's, of course, a great pleasure to be able to moderate this really important conversation on mental health. Can I start by thanking Damien and PwC for their sponsorship, but also a number of other sponsors who have sponsored this series of conversations. BHP, Uni SA Business School, SA Power Networks and Uni Super. We couldn't be bringing these conversations to the wide audience that we are without the support of our sponsors and the engagement of our members. So it goes without saying that I'm very appreciative of that, and thank you so much for the support that you've given for today's discussion, but also more broadly. Mental health is, of course, an issue which is incredibly important. It deservedly is getting more attention and more focus in our public conversations and our policy conversations. There's more conversation today about how we manage mental health as friends, as family members, as employers, but also, I think rightly, conversations about what the best way forward is for us to handle these challenges from a societal perspective, and what the policy shape might need to be to better deal with mental health issues. It's a conversation that's critical in Australia, it's a conversation that's critical around the world, and it's something which is being brought even more to the fore now, I believe, with the challenges associated with the COVID-19 crisis that we're all living through. And Damien spoke to some of the issues and challenges that are emerging as a response to our having to live in different circumstances. We're social human beings, and living in isolation is not something that comes naturally to most of us. So that's bringing a lot of unique and unexpected change and challenges to all of us. And I think we're in for a very interesting discussion today to understand what we can do about that, to learn a bit more from one of the experts, if you like, on what we can do about that. We do, of course, want our audience to be involved. It is a big audience today. You can ask questions. There's a link at the bottom of your screen, and you can get onto our question app, which is Pigeonhole, which is CEDA.pigeonhole.at, and the password is mental health. When you get on, you'll see that we've got a survey running. We thought it would be interesting to get your insights and perspectives on whether in this period of isolation you've actually found that you're more aware of your own mental health circumstances. So we'd really appreciate your insights on that. And as I said, really looking forward to getting your questions so that we can have a really full conversation following Julia Gillard's presentation. So then let me just go straight to introducing the person that Damien rightly said actually doesn't need any introduction. Julia Gillard, the chair of Beyond Blue and, of course, former Prime Minister of Australia. Thank you for joining us today, Julia. We'll hear from you for about 10 minutes and then we'll go to question and answer with the audience, albeit done a little bit differently now, virtually. Thank you so much for being part of this. One other thing. I should say that we're really keen for this conversation to be taken to the widest possible audience. So if you can support us through social media to get the message out there, please do. Make sure that you mention us at CEDA_news, and the hashtag for all the social media is mental health as well. Sorry, a little bit clunkier there, Julia, but now over to you. Thank you.
Thank you to Damien and to PwC and to everybody for joining us. I start by acknowledging the traditional custodians of the land on which I'm standing, and in a spirit of reconciliation, I pay my respects to elders past and present. I extend my respects to any Indigenous peoples joining today's webinar. Wherever you are, I know you too acknowledge and pay respect to our First Peoples. It is wonderful to be able to be with you and having this discussion today. These are, of course, complex times. When I accepted the invitation earlier this year to speak to CEDA, none of us could have imagined what the world would be looking like when we were going to have this conversation. But it's still great to be with you, and it's good to be here. For many of us, we've been left reeling, trying to comprehend the pace and the scale of change, not just here in Australia, but around the globe. As human beings, we are hardwired to crave stability. We like to feel in control. The pandemic has rocked our sense of certainty, and no one has been left untouched. As we try to process this unsettling turn of events, it's natural to be feeling fearful about the future. But it's important to remember that whilst it's tough right now, and it is, we will come through to the other side. The encouraging progress we've made in slowing the spread of the virus is a testament to the community-mindedness, creativity, and resilience of individuals, of families, and of businesses right across Australia. Given the social, emotional, and financial impacts of this pandemic have hit many Australians hard, the road to recovery will be a long one. However, it's not all doom and gloom. There are opportunities and reasons for hope emerging as we navigate our way through to the new normal. Today, I want to talk to you about the work we're doing at Beyond Blue to support the community and to share some thoughts about the approach we can all take as the economy reopens. As coronavirus hit our shores, at Beyond Blue, we expected call volume to our telephone support service to increase. We were expecting an increase of around 30% by June. What we actually saw was by March, a 42% increase. In 1 week, our Coping with Coronavirus thread in our online peer support forums increased 7 times above the volume of traffic of the bushfire thread. So that's giving you a sense of the comparison. We all remember how we felt during the bushfires, and yet we saw 7 times the engagement. Initially, people were telling us they were anxious about their health, about their loved ones getting sick, and about whether we'd see similar scenes to those in countries with devastating death tolls. As physical distancing continued week after week, increasingly people reached out to us because of their struggle with loneliness. And then since Easter, we've seen a new trend, a new thread in the discussion, a sense of being overwhelmed and exhausted, being at home, homeschooling, all taking its toll. And of course, there are those who are in financial distress. What has been heartening, though, is the spirit of collaboration and common purpose we've seen across the mental health sector, across industry and all levels of government, to rapidly scale up mental health services to meet demand. The National Cabinet is certainly one welcome initiative. Funding from the federal government and Medibank has allowed Beyond Blue to rapidly build a dedicated coronavirus wellbeing support service, which is free to all Australians 24 hours a day, 7 days a week. It includes a digital site filled with advice, self-help tools and articles on everything from how to cope with loneliness in self-isolation to managing financial stress or how to stay healthy while working from home. There are easy links to online peer support and a counselling telephone line staffed by mental health professionals. We need this variety of approaches because everybody's needs are different. Some people benefit from basic stress management and short-term self-help strategies. Others require more intensive support over a longer period. The research tells us that after significant disasters, some members of the community will experience post-traumatic illnesses or depression. That makes early intervention essential if we are to protect the mental health of all Australians. And we hope the new coronavirus mental wellbeing support service will help cushion the blow. But it's not set and forget. As a community, we have never been in this situation before, so we will be continually adding new content and support channels. We know that the needs of the community will evolve just as the pandemic will. On the road to recovery, we expect some groups will require more support than others, because whilst the virus does not discriminate, the long-term impacts do. A recent Grattan Institute analysis of the COVID economic impact found that for those on low incomes, they are twice as likely to be out of work as high income earners who have a greater capacity to carry on their jobs remotely. Younger Australians and women are also more at risk of losing their jobs because they're likely to be in casualised work or in the industries that have been shut down by government decision because close physical proximity is required. We already know that the long-term effect of unemployment on mental health is significant. It can negatively impact a person's sense of identity, self-worth and purpose. And the longer any form of physical distancing measures remain in place, while they're essential in the fight against the virus, the more stress will be felt by members of our community. This includes those living alone, the elderly, the homeless, and people whose homes may not be safe due to family violence. For some people, this period of instability will precipitate or worsen mental health conditions like anxiety or depression. For some, this crisis comes on top of the havoc already wreaked in their lives by bushfires or years of sustained drought. As we work to reopen and recover, the key challenge is to sustain a sense of collective purpose once the immediate crisis has eased. How can we remain united and responsive to the larger public policy issues in the absence of the singular and overriding effort to flatten the curve and protect lives, and sustain a binding sense that we're in this together? What happens when other curves that impact participation and productivity, unemployment, underemployment, emerging mental health issues need to be flattened too? One question I would pose to the audience today is, what contribution can you make to helping the community stick together during the next phase? And a second question is, what have you learned in this period that you will take with you into the future? In mental health, we're already seeing opportunities emerge from the pandemic and the potential to transform the way that we deliver support in this country. Necessity has given rise to the kind of innovation that Beyond Blue and others have been arguing for years. The introduction of universal telehealth is a game changer. Of course, it doesn't replace face-to-face contact, but it will provide greater choice and prevent some from slipping through the cracks. At the same time, it will ease pressure on GPs, hospitals, and emergency departments by enabling continuity of care for those who need it. The other important lesson we're learning is that our greatest experts in these times of immense upheaval are those with lived experience of mental ill health. Every day we see in our peer support forums how invaluable their insights are for the wider public's health. They can share lessons that are unique to them and meaningful for others. We can draw on their wisdom, courage, and hard-won resilience as we support the community through this pandemic. Everyone online today would have heard of post-traumatic stress disorder. It's real, and many will live with it post-coronavirus. But there's another phenomenon to keep in mind: post-traumatic growth, which is the ability of human beings to find a renewed sense of purpose and gratitude after challenging events. I would ask you to reflect on that and what growth you might experience. I'm certainly hoping that employers will take from this crisis a new appreciation of the possibilities for flexible and virtual work, which are both better for work and family life balance and can be better for people's mental health. I also hope that as employers plan for the new normal at work, that mental health is prioritised. Many chief operating officers, office managers, business owners would already be thinking about how to restart offices or other places of work, what physical distancing arrangements will be necessary, how to source supplies of hand sanitizer and the like. At the same time this vital work is done, it is possible to also plan how businesses can support the mental health of workers who are re-emerging after this stressful and isolated period. Tips on mentally healthy workplaces and how to build them are on Beyond Blue's website. I genuinely believe that if we can get all of this right, while there is naturally trepidation about what lies ahead, there's also reason for hope. Our worlds may have temporarily shrunk, but our perspectives can expand. Life may never be the same again, but I'm hopeful that together we will get to the other side of this and be stronger for it. Thank you for getting involved in this discussion today.
Well, thanks, Julia. Now I'm almost blown away about where we start. You've managed to bring so many fantastic insights in such a short introduction. So let's get started. I'm just waiting for the survey results. I've got one more line to come in, so I'll come back to those. But let's start where you finished, which is this issue around the workplace and a mentally safe, healthy workplace. I think one of the fascinating features of this crisis has been the pace at which it's just hit us and the way it's moving through, partly because we've done such a good job of isolating the virus. But it was only it feels like, what's a short number of weeks ago, 6 weeks ago, that we went from being in an office environment to now being in a home environment and having to adjust to that. And now, as you said, we're now sort of looking at how do we transition back into a workplace. So I'm interested in your perspectives on, what the key priorities are in terms of, as an employer, thinking about the mental health of our employees, and perhaps some of the signs that we might be looking for that maybe not all of our employees have managed the isolation as well as we think they might have, but also that transition back. So a big question there, but just at a very practical level, what are the things we should be looking for? What are the things that we can do? How can we help others as well as ourselves?
I think that is a complicated question, but it all comes back to communication and trying to understand people's perspectives. I think we'd be kidding ourselves if we thought that people would go from being in this kind of environment that we have for a number of weeks now and return to the office and just be their old selves immediately. So the fact that you might see some behaviour changes from the person you normally know, that, Susie or Maria or John doesn't seem to be behaving exactly the way they normally behave, I wouldn't necessarily say that spells trouble. But if you do see sustained changes in behaviour, certainly more withdrawal from engagement with others than you would normally see, then that should trigger some conversations about what's going on in people's minds. It might be that the stresses of this time are still very burdensome on their shoulders, but it might also be an indication that perhaps they need to reach out for help. And people can feel very uncomfortable about those conversations, but all of the research we've done at Beyond Blue shows that you don't have to be a big-time mental health expert to have a productive, caring conversation that can make a difference for people. Also, we know that clarity and a sense of control make a difference to people's mental health. Now, clarity about what life is going to be like is in pretty short supply. So I'm not under any illusion that the people online today can, get out their crystal ball and see the future. None of us can. But as bits of what your business is going to do become clearer and clearer, the more you can communicate that so people can have that sense of greater certainty, greater understanding of the future path, the better. Second, as we get that clarity, people's self-control or sense of self-control is also important. If they feel like they're just being told that they're passive, that they've got no say in the future direction, that can be very undermining. So whilst this isn't an easy age for consultation because of the physical distancing, if you can build as much of that in as you plan your reopening and restart, it'll pay dividends.
Well, thanks for those insights, and I think you've hit the nail on the head in terms of two key priorities: caring conversations. So it's not necessarily about having all the answers or being someone's counsellor, but I think just starting the caring conversation, letting people know it's okay to talk about these things, and being able to direct people to the sorts of services like Beyond Blue that can then provide them with a variety of support and professional support that they need. And I think on the communication front, we know in any crisis that clear communication is fundamental to helping people cope with that. And I think that the message there from you is that I think there was a clear focus at the beginning of the crisis to the extent that people could communicate clearly or try to provide some insights around how things might unfold. But as we go through to the recovery phase, there's just as much uncertainty, and it's going to be just as important. I think one of the things we're seeing from this little poll that we did, Julia, asking people about how much more aware are they of their mental health. 41% of the respondents to the survey are saying that they're a lot more aware of their own mental health, and 50% are saying somewhat more aware, 8% about the same, but no one is saying that they're less aware of their mental health. I think that's the foundation on which each of us can sort of think about having those caring conversations, because we're all much more aware of how the situation has impacted us, and sort of taking that and turning that into conversations with those closest to us, be they friends, family or co-workers, is a really good place to start. You talked in your comments about the different groups that this crisis might have a longer term impact on in terms of their own financial well-being, their capacity to participate in the workforce, but then, of course, more broadly, what that means for their mental health, and just the scale of the numbers that you spoke to early on about the growth in demand for your services. How does the system evolve to provide the support when the need is so much more dispersed and actually just so much greater?
Yeah, we are certainly advocating some new models. I mean, we've got to remember that we put this mental health crisis on top of a system that needed reform. So, and governments were already very much in the reform era. We had, the Productivity Commission, the Royal Commission in Victoria. People were acknowledging that the system needed reform. And now we've put the burden of the pandemic associated mental health issues on top of that system. Now, we actually think that that means that we can speed up some of the reform directions that have been advocated for a long time now, but that this crisis can accelerate the development of. It's already done it to some extent in the telehealth provision. I mean, we've been calling for that for years, and here we are now, and people are online, they're using it, they can see mental health professionals online, and we should never go back. We should be integrating telehealth services into our ongoing vision of what the mental health support service should look like. That's a key way of giving people access, particularly given in Australia, we know that the mental health workforce is not well distributed. Like the health workforce generally, once you get beyond the big cities, then it gets harder and harder for people to find someone in their community. Second, we think that this is an opportunity to build in some low intensity models of care. We talk about stepped care, people being able to get the right support they need at the right time with the level of intensity stepping up depending on how people's acute needs are. And I think that sort of staircase model is a good mental image, but if we look at today's care system, a number of the steps are missing. So you can take one or two and then you'd have to really jump to potentially get to the next one, and the level of care that you need isn't there. We think one level of care that's missing is counselling support, which can prevent people spiralling into a deeper problem. We at Beyond Blue have innovated something that we call New Access. It gives people access to a coach. Where you don't have to have a medical referral. It's free at the point of access. And we've had tremendously good evaluations about the difference that can make. More than 70%. It made a profound difference in their lives. We are using this period to take that into a telehealth model. And we think if we can see the development of those low intensity services around Australia, then that will make a big difference to the stepped care approach and its availability. That's not a complete list of all of the things that need to be done. There are, of course, needs in acute care as well, but the beyond blue special area of expertise is, promotion of mental wellness, early intervention, early action to try and stop things just, getting to a stage that they are much more disturbing in people's everyday lives.
Those points are, in a sense, not surprising, if you like, because they're so similar to messages we hear in other areas of human service delivery, really. And I know when you go and have a look at the Productivity Commission's Shifting the Dial report, I think, what I'm hearing you say is focus on early intervention, focus on prevention, and focus on the capacity for more joined up care, essentially, which are sort of repeat themes that we see across a number of different areas of human service and human care, basically. I know in the UK, one of the big step changes they made some years ago was doing exactly what you're talking about, which was sort of focusing on the sort of lower level need, which isn't to say it's not important, but there'd been such a strong emphasis on acute care that focus on coaching and counselling hadn't really been there. And when they provided more support at that lower level, it really transformed it. We've seen an increase in funding. We've seen telehealth now opened up. Are you just assuming that those things are going to be sustained, or are there systems changes that actually now need to be sort of locked in, if you like, to enable the sorts of services that you're talking about to really become par for the course for all Australians?
Yeah, there are system changes that need to be locked in, and the National Cabinet, federal government haven't as yet made their full set of statements about mental health. I think one of the things that's been terrific to see at this time of, real community concern is that there's been such a focus on mental health from the start, and your survey results actually verify that. If we imagine this pandemic 10, 15 years ago, I can't, in that world, governments, organisations like CEDA, individual employers, individuals themselves would not have been saying to themselves from the start of the crisis, right, I've got to be thinking about mental health as I'm dealing with the physical virus challenges and the physical health system and how we meet needs. We've seen every level of government, employers, the community generally, individuals very thoughtful about mental health from the start. And I'm very optimistic that that will continue and that we will see the federal government, the National Cabinet, continue to make statements about mental health and how to meet needs as we get into the next stage when people are making returns to sections of the economy as it reopens. That isn't a substitute, though, for then when we've got the government space to do it, to returning to the mental health reform agenda. So it's like we've got two things happening at once. We've had the longer term reform conversation. We've got to keep that on track, even though we're going to emerge from this in fiscally different circumstances than any level of government expected to be in. We've got to keep that on track, and then we've got to quickly lock in the adaptations that have worked so well during this phase.
So I had a question from Caitlin in the audience who, in some ways I think you've maybe answered her question, but let me put it to you very directly. You spoke in your comments about, in a way, challenging us to think about the things that we can hold on to that we don't want to lose sight of. In a sense, the fact that mental health has been front and centre has sort of helped to break down the stigma associated. It's normalised it in a time of crisis. As we come out of the time of crisis, is that going to remain the case? Have we broken the back of the stigma of mental health?
Oh, we certainly haven't broken the back. I can't tell you because as far as I'm aware, the research hasn't been done yet about what change in people's attitudes have been occasioned during the weeks of the pandemic and the dialogue about mental health. But before we went into this period, research showed that people feared stigma in a way which stopped them reaching out for support. And the statistics pretty startling. Almost half of people don't get the support they need. And while some of that is issues in the service delivery system, some of it is stigma. We did a big piece of work with our first responders, police and emergency services. And one of the things that was very interesting out of that research is when asked, would you treat someone differently in your workplace because they said they had a mental health issue? People said they would be caring towards that person, they wouldn't stigmatise that person. But when they were asked, would you put your hand up and say, I have a mental health issue, people said they feared the stigma. So they were actually holding it back themselves, self-stigmatising. The fear of the stigma was so much that they didn't reach out for the care and support that they might need. And I think we will still see that as we come out of the pandemic. So no, we're not in a happy world where we've defeated stigma. I think that means we've got to keep talking about mental health. We've got to keep embracing these concepts, keep the dialogue as open as possible. And we've got to do that even at a time when we're not as close to the proximate cause as we are now. That's one of the things that I really worry about. Where at the moment we can all say, right, we're in the middle of a pandemic, we're at home, things aren't normal. We can understand why that's stressing on people. We could understand why that might be exacerbating mental health issues. But as things get more normal for some sections of the community, but are still nowhere near normal for others, people who have lost their jobs, for example, or whose businesses have had to close, in 6 or 12 months' time, will we still have that sense of, I get why you are in these circumstances. I still understand that it is a manifestation of the crisis that we were experiencing 6, 12 months ago. We've got to keep holding that understanding with us.
I think that's such an important point, because I think when you're sort of, for want of a better description, in the eye of the storm, I think there's perhaps everyone understands you're grappling with new things, and it is incredibly stressful. I am concerned that when we start to recover, it'll feel better, but it's going to be different. And I think the stresses and strains, even just the realisation that what we're going back to is not going to be the same level of social engagement and social interaction. And also the financial stresses and the issue around unemployment, I think, is very real. And what we've seen, what we know for people who are unemployed for an extended period of time, is the isolation that comes with that. So in a sense, the risk is that we have a significantly larger pool of people who in 6 months' time are feeling a completely different kind of isolation, but they're now perhaps a little bit more disconnected or less connected to others in the community. So it feels to me like the impact of this crisis are going to be quite long. And as I said earlier, they're going to be impacting different parts of the community in different ways that perhaps even those who provide these mental health services haven't seen before. So the agility and capacity to respond is really going to be put to the test, I think.
No, you're right about all of that. I mean, if you wanted to just boil it down and say what are real stresses in people's lives, if people don't have a sense of purpose, and for many people that sense of purpose and daily engagement is provided by work, so the loss of work, unemployment hits people very profoundly in terms of their mental health. So a loss of a sense of purpose, financial stress, particularly if it jeopardises people's ability to maintain their housing, to be living where they are. Having a roof over your head and a safe space is very protective of people's mental health, and the loss of those things is very corrosive. And then, human connection matters to mental health. Now, people can find that in family, they can find it in friends, but they also find it in their work colleagues. And if that's taken away, then a lot of friendships, a lot of things that people are relied on aren't there in their daily world in the way that they used to be, and that can be very difficult for people. And if you look at the financial circumstances many people will find themselves in as a result of this pandemic, they will have lost that sense of purpose. They will be feeling the financial pressures. They might have some issues about their housing and a loss of density of connections that used to support them day to day. So that is very concerning and does mean that we've got to be there with the helps and supports that will enable people to try and find a way through. Now, the mental health system can only do so much. There's a whole other set of societal responses that will ease the way for people in those circumstances. So, you know, the economic policies, the supports that people have coming from government, community organisations matter a great deal too. But we do, in the mental health community, have to be ready to respond and in front of the waves of demand. If we've learnt anything from this crisis at Beyond Blue, we know what it's like to see the surge come and to then really quickly have to respond, and we need to be in front of the future waves.
Just on that, do you think that there'll be an opportunity or a move towards greater cooperation across sectors? So you've got organisations like Beyond Blue providing incredibly important services. Do you think collaboration with the business community and with businesses themselves is something that might sort of evolve as we try to grapple with the diversity of need and just how we actually resource that?
I certainly hope so. I mean, for quite a long time, Beyond Blue's been in the business of trying to talk about mental health at work. I mean, there's certainly survey data that shows, and that this is from well before we were in today's circumstances, survey data that shows if you ask employees, you know, how important is physical safety to you at work, people say it's very important. How good a job do you think your employer makes of keeping you physically safe? Overwhelmingly, people say, my employer does a good job of keeping me physically safe. If you then put those questions on mental health, you know, how important is your mental health at work? People actually say more important than physical health, interestingly. And when asked how good a job is your employer doing, they rate their employer far less than they do on the physical health dimensions, which means employees are seeing that, you know, there's been many decades now of employers' community response about making workplaces more physically safe, wanting to cut fatalities at work. That job's still not done, but we're certainly, you know, far better than we were 10 years ago, 20 years ago, 30 years ago. The direction of travel has been towards safer and safer workplaces in terms of physical accidents and illnesses and injuries. Employees now want to see that direction of travel in mental health as well. And there are resources that Beyond Blue provides to employers through our Heads Up work to help them plan how to create a mentally healthy workplace. And that isn't, you know, it isn't a simplistic thing about absence of stress or anything like that. I mean, short-term, you know, stress is, I think, always going to be a feature of human existence, and you know, it can elevate people. They can thrive on the sense of achievement they get from doing something that needs to be done, that's difficult, that needs to be done urgently. So it's not that episodic stress that's the problem. It's the ongoing issues of stress and alienation at work that are there all day, every day, and our resources to employers are about addressing them.
I've got a question from Ingrid, and this may be a little bit early, given how recently it's been the announcements around sort of removing some of the restrictions on social and economic activity have been. But Ingrid sort of made the point that some people have actually found being at home, working from home, less stressful. You sort of alluded to that in your opening comments around the benefits of the flexibility. But so being at home has been beneficial, less anxious. I can relate to that in some ways because not having to travel has certainly taken the load of stress out of my life. But she's wondering whether Beyond Blue's seen any indication that stress levels are increasing with the prospect of returning to work.
Yeah, we don't have the ability to sort of do real-time diagnostics like that. What will be interesting is the thread lines in the calls to our coronavirus wellbeing support service and the thread lines in terms of, the online chats and all the rest of it. So we did see that shift around Easter where exhaustion became much more of a topic than it had been earlier. And it'll be really interesting to see if concerns about work return starts to be a big topic in the weeks to come. And I can understand that there's some balances here, and I do hope out of this that one of the things we take with us is what can be done in workplaces, learning from this experience that alleviates people's stress and gives them a better sense of balance in their lives. I mean, I've got friends who work in all different sorts of industries, and a number of them have said to me, look, women who have, predominantly women, not just women, but women who have particularly asked for these flexibilities about doing work at home have been told, no, it's not possible. That sort of work process has never been done virtually. It'll never be able to be done virtually. No. And here we are. And guess what? All of those work processes are being done virtually. So I think that's an indication that there are things that can be learned from this that help people, not in every occupation, because some occupations are quintessentially about personal attendance, but for people in many occupations, to give them more options and more choices. And if employers and employees can harness that, then maybe we will be looking back at this time as still a very difficult time in the history of our world, and a time that caused a lot of loss and grief, but also a time that changed working cultures in a way that we remember as a very significant growth spurt and set of achievements.
I think it's a great point. I mean, you mentioned before the shift to telehealth. There's so many things that people have sort of been pushing for and sort of trying to see progress made, that it was just so difficult. And then literally overnight, things have opened up and opportunities. And, there's pluses and minuses in each of them. Telehealth isn't the answer to everything, but in a system that is constrained by resource challenges, it does provide so much more opportunity. In the same way that being able to work from home can provide flexibilities. I think the point about exhaustion, though, is that the flip side of that is work has certainly been ever present at home, which has its own challenges. But let me ask you a question from one of the audience directly. Is this the moment when we see a fundamental shift in balance? And the question was put really around, men being at home. We talked before we came online about more fathers picking up their kids at school. What's your view on that? Is this now a shift that we're not going to go back from, that we're going to see a bit more balance at home and work?
Once again, I'm a long or medium to long-term optimist, but I think there are some challenges in the short term. There's an early data set. So this is a bit less with my Beyond Blue hat on and more with my Global Institute for Women's Leadership hat on. But there's an early data set that was reported in the UK done by Cambridge University, I think, where they looked at the distribution of the additional domestic and caring labour at home that needed to be done during lockdown. So, particularly homeschooling and who's attending to it. And what they found was not a shift in the gender distribution of that work. They found that the underlying gender dynamic just had a new task put on it. So yes, both men and women were doing more time caring and educating children because they weren't going to childcare and they weren't going to school. But the differential where women did more was holding as that extra load got put on top. I am hoping, though, that we do learn from this, and I think I'm enough of an optimist to say maybe that data set done in the early weeks of lockdown would already be potentially out of date, because I think many couples might have approached the first few weeks of this with the same underlying dynamic as to who did what at home, but just working that dynamic because the kids were there 24/7. But over the weeks of lockdown, have had the conversations and have started to come to a new understanding of who needs to do what. And I can imagine that for, if you imagine a lot of couples in family formation stage, people obviously make all sorts of choices, but a very common choice is for men to work full-time and women to work part-time. I imagine for a lot of couples in that position, a man who's worked in the CBD with a long commute is probably seeing and experiencing things at home that have been just out of his line of sight because, he's needed to be on the train not long after 7 o'clock in the morning and probably not getting back much before 7 at night. And so I do hope that that leads to some new dialogue in households about the divisions of domestic labour. And if we had those conversations, then we might not only be returning to a world of work that is more flexible because we've learned so much from this time, but a world of work that's more gender equal as well, because a key to genuinely equal advancement prospects for women's careers is a different and fairer distribution of domestic and caring work.
Do you think, just on that, do you think there's a role for an organisation like Beyond Blue or another organisation to actually, almost in a preventative sense, think about the tools that might be needed for families to be thinking about how they go from this situation to a sort of new normal, and to sort of, deal with the stresses of that up front?
I think we've certainly got tips for families in our coronavirus set of resources. I'm not sure if we've got tips on negotiating new norms in families. You might have set me and Beyond Blue some homework, so I'll take that with me. But we've certainly got tips about how to talk to kids about this stressful world, tips about managing homeschooling. And you did refer before to the problem that every hour can turn into work because it can be done virtually and flexibly. And we've certainly got tips about routine. When I spoke earlier, I said that we're as hardwired as human beings to want stability. One of the things that gives us a sense of I'm in control rather than I'm just getting pushed around by events is having some rhythms that you establish. So, and I think, there is a message for employers here. If you are expecting employees to be answering their first email at 6 a.m. and answering their last one at 11 p.m, then you're not helping people get that. I might be at home the whole time. I might be in my, sports gear or, new Zoom outfit of sloppy jumper and, track pants. But there's still a difference between being on and working and being time with the family and being at rest and decompressing. People do need to set some boundaries there.
Julie, I'm conscious that we're going to getting close to time, but I had two more questions, if that's all right. And
Sure.
I'm going to change gears on both of them. So I'm apologising now for the mental strain that this might impose. Can we go high-level policy? The Productivity Commission, of course, is doing its report on the mental health system. Interested in what the priorities from Beyond Blue's perspective are for that inquiry. What would you like to see from there? And then I'm going to ask you a leadership question, if that's all right.
Sure. Well, any real blueprint for mental health reform requires huge Commonwealth state collaboration. And one of the things I'm hopeful about in this era is that we've, worked that Commonwealth state collaboration muscle pretty hard to deal with the pandemic. So I hope that it's strengthened for the challenges ahead. And whilst we're not always going to keep national cabinet, I hope we don't just go back to the incremental world of COAG, that we do keep this pace of Commonwealth state collaboration more accelerated, and that would be good for mental health reform. So a key priority from the point of view of Beyond Blue is working the system out so that there aren't gaps, holes, duplications because of what the Commonwealth does and what the states do. Genuinely making it a stepped cared system, as we talked about before, with a key focus on prevention and early intervention. We think all of that is vital. We do believe that there will need to be additional resourcing for mental health, but we also think that there is potential that can be unlocked if we can get the system to be more efficient and effective, because we do address these Commonwealth state running across each other, lack of clear pathways for people style issues.
I think one of the other messages I hope that we manage to entrench from this crisis, I'm going to go on a slight little tangent here. I was really interested in some of the evidence that was coming out through the support that was provided to homeless people through this crisis and getting them a place to stay, and the cost savings that resulted from that and helping them to get across their health concerns and issues. And the one case study I saw was a woman who'd been homeless for a long period of time. She finally had accommodation as a result of the crisis and trying to keep the community safe. And then all of a sudden people were able to ascertain how much pressure she individually was putting on the health system just through repeated visits to casualty and things like that. And then once they could get ahead of that, actually the savings were quite demonstrable. So maybe we can develop a longer term appreciation of what the true costs and benefits of investing or not investing in mental health are. Now my question on leadership, and I'm going to try to cobble together a bit of sentiment that's coming through from some of the questions. And let me put it like this. Firstly, one of the questions sort of observes that it's been really interesting to watch leaders in this crisis have to admit to not really knowing what the answer is, and to grappling with uncertainty in a way that is perhaps not typical from our political leadership. And secondly, that we're at a moment where, previously I think there was a sense that, economic outcomes were always put first and foremost, and now we've had to deal with the health response, and we've been talking about mental health, and there's a sort of broader perspective of what success looks like. So I guess if I bundle those together, do you see leadership changing fundamentally from here, and leadership priorities perhaps being expressed in a broader way than they have in the past?
I think if I can start just at a little different point with your question, but it does come to this question of leadership. I actually think voters are going to change perspectives from this, and over the long sweep of politics, no matter who's in or who's out at any given time, if community attitudes change, then that reflects into politics. And I mean by that I think it has been possible for people for quite some time now to say to themselves, government doesn't really matter that much to me. And, we've got a larrikin culture and a healthy ability to laugh with and laugh at our political leaders. And I think a lot of Australians kind of thought to themselves, well, whatever they're running around doing in Canberra doesn't really matter to me, and I really don't have to pay that much attention to it. I think this crisis has centred us and reminded us government really matters, and who gets to run it, how they're running it, and the values by which they're running it really matter. And so I hope that we're in part going to see changes in leadership because we're going to have more community demand based on that understanding that I get it now. When push comes to shove, government really matters to me. It matters to me, my family, my community, and I'm going to be very clear with the politicians, local, state and federal, about what I want. And when people are asked that, I think coming out of this period, they're going to put forward a set of demands to political leaders that are about physical safety, yes, pandemic preparedness. We'll all have learned lessons and people will want things done. But I think it will be that sense of community bonds, community building, what enabled us to get through this and how can we keep adding to that for the future. All of that means that I am hopeful that coming out of this, there will be some centering in the way voters will centre themselves. I hope politics will be centering itself around the key things that really matter to people. I hope we've come out of this with a new understanding about why expertise matters, a new preparedness to say, I get it's difficult and I understand you need to think about it for a while, so let me give you the space to do that instead of demanding the answer yesterday, and a broader set of perspectives than it's just about the economic numbers. The economic numbers are absolutely vital, but there are community metrics that I think people have now got in their heads that they'll want weighed into the debate. So it could actually be a very interesting and productive time for the community and for politics as we take the lessons with us. Noting, of course, that I don't want to sound as if I'm disconnected with the gritty reality. We'll need that because so many people will have been hurt so profoundly by this that rebuilding has to work for them.
Well, thank you for those fantastic insights. From my perspective, a really good way to conclude our conversation in this CEDA live stream. It won't surprise you to know, Julia, that we at CEDA think that policy really does matter. Government matters, governing matters, and policy really matters. And I think there is a great opportunity for us now to have some serious policy conversations, obviously to put recovery right to the fore, because we do need to stabilise our economy, because without that, our choices for other things are more limited than they ought be. But there is a great opportunity, and hopefully we can get to a point in those conversations that we're involving as many people as possible, that the community does realise how important that they are, and that we can actually, come back stronger as an economy, as a society, from this crisis. And I think it echoes back to where you started in your remarks, Julia, around challenging the audience in a way to reflect on what they can do to contribute to community at this time of recovery, both in an economic and a health sense, but also what they can do from their own perspective to learn from the crisis and to focus on what really matters and to try to hold on to that as we sort of move forward through recovery and in a different world of more activity, but still some aspects of social distancing, and we all learn to deal with that. Thank you so much again for your time. Thank you, Damien. I know he's off in our virtual world, but thank you, Damien, for your participation and support for today's live stream. also to our other sponsors, BHP, Uni SA Business School, SA Power Networks and Uni Super. We've got more live streams coming your way from CEDA. The next one will be addressing this issue around supply chains, what we've learned about our supply chains in Australia and what might need to change with supply chains in the future. CEDA is doing a bunch of research on that, and our next research piece on that important topic will be released this week, and the live stream discussion will take place on the 28th of May. All of the information about those live streams and all of the other work that we're doing, the blogs, the podcasts and past live streams are available at ceda.com.au. So please log on there and have a look at what we're up to, register for live streams coming up. And I'll look forward to engaging with you in the future, whether it be a live stream or a virtual roundtable or some other format, and hopefully in due course, face-to-face. Thank you again, Julia Gillard. Thank you again, Damien Angus, and thank you all for participating in today's live stream.